The data shows that approximately 1 in 4 individuals in Wisconsin suffer from mental health and behavioral health issues. So it's evident that the HW Endowment should invest resources to support our communities in the hurdle of overcoming these issues.
It was wonderful because we were taking all these folks that had been siloed around mental health issues and behavioral health issues and bringing them together.
At the HW Endowment, we knew that the complexities of tackling behavioral health in these communities was beyond any one organization to tackle on their own. Thus, the importance of coalition building in communities so that a group of organizations, along with systems within that community, could tackle these issues together.
Our geographic area is Ashland and Bayfield counties and Bad River and Red Cliff tribal communities. So we think of ourselves as the Chequamegon Bay community because we're all surrounding that Chequamegon Bay, and that's what kind of unites us. It's that kind of a natural geographic area. There's about 30,000 people, maybe a little bit more between those two counties.
In the far north, where we have a mixture of tribal nations and other people, there were several officer-involved shootings.
One, it's providers in those counties that are working with people on behavioral health issues, and then also our public safety facing folks. The people we want to serve are the people that are most at risk for emergency detention or negative outcomes when encountering crisis.
One particularly innovative strategy that has emerged is in northern Wisconsin, in the Ashland-Bayfield area, where they recognized that when people have a behavioral health crisis or a mental health crisis, it can be very traumatic. A lot of times the only resources available, especially in a rural environment, are law enforcement.
So our area has some challenges that we face in terms of poverty. The rural nature of our communities means that we don't have a lot of services. And so the challenges that we noticed when we came together as a work group was that crisis was one place where it was negatively affecting individuals and agencies, but no one person owned the whole kind of spectrum of crisis. So we saw that as an area that we could come together to see what can we do to improve crisis outcomes for people in our community. And why crisis was important was that emergency detentions were kind of the place where we saw the most negative outcomes, both for individuals, because that can be really a traumatic experience to have it go through an emergency detention.
We can give law enforcement tools. So what they've done in northern Wisconsin is they have implemented what they're calling a safety plan program, where individuals can create their own safety plan in preparation for, if I have a mental health crisis, who do I need to reach out to? Who do I need to activate in my own support system to help me?
And so when we started our project, it was before the COVID-19 pandemic. And what we saw is after that occurred, lots of changes happened and needs increased.
And so I feel like in some ways, their job got harder because right at the point where they should be getting traction, the job got a lot harder and the entire context shifted.
So the approach that our work group took after a long time kind of coming together to identify the problem was this problem of information sharing and teaming at the time of crisis. And so we wanted to say, what can we do at that point to help make connections between the individual in crisis?
And we're allowed to share that information with law enforcement through releases of information and privacy, a lot of privacy guardrails put up for the people having mental health crises. But what that means is a person can have a mental health crisis, and instead of having to go to Winnebago, instead of having to be driven hours away, instead of being put into the back of a police car, their safety plan is activated and they're able to receive the care that they need within their own community.
The first responders coming to address the situation, and then with the folks that can provide the services to help that person's life improve. And the thing that we came up with was a community-wide crisis plan. So that crisis plan is something that an individual says, if I'm in crisis, here are the things that I would like my community to know that might help me. Here are the people in my world that you can call that might help improve that outcome. Here are the things that you can do to help de-escalate the situation. And here are the things that are really important for me to tell you when you're trying to help me.
It's going to be interesting to see where people get to in terms of the systems changes. But we know already that there's changes that have happened in communities that would not have existed absent this initiative.
Our hope is that the resources and the capacities that have been built within the backbone organizations in each community, as well as those coalitions, will strengthen the communities and enable behavioral health strategies to live on.
Every time we brought our group together, we gave them some scenarios, we asked them questions, we took their feedback, and then we came back with a straw man for them to think about the next time. And that iterative process that we did over and over the course of a year helped keep folks invested and excited to come back. And it meant that we had deep roots when we started to implement this project, because it was not a small lift for people to change their workflows and try something new.